In 1901, Dr. Alois Alzheimer observed a 51-year-old patient who had strange behavioral symptoms. In particular, he noticed that she had lost her short-term memory. 5 years later, when she died, Alzheimer evaluated her medical records and also her brain. He and his Italian colleague, Dr. Gaetano Perusini, used a particular staining technique and identified in the cortex peculiar histological anomalies shaped as plaques and fibrillary tangles. These brain anomalies have been later called amyloid plaques and neurofibrillary tangles and became the identifiers of what today we call Alzheimer's disease, or simply with its acronym AD. AD is the leading cause of dementia in elderly people. Initial symptoms are often mistaken for normal aging, but instead AD is a neurodegenerative disorder, starting slowly and gradually worsening over time. Characteristic traits of AD are memory loss, difficulty in remembering recent events, and as the disease progresses, social isolation, lower quality of life, and loss of self consciousness. The cause of the symptoms is a slow but inexorable neuronal death that tends to involve specific brain areas responsible for memory formation and retrieval, such as the cerebral cortex and the hippocampus. The definitive diagnosis of AD can only be confirmed by assessing the post-mortem presence of amyloid plaques and neurofibrillary tangles. Amyloid plaques are extracellular aggregations of the A-beta 142 peptide, while neurofibrillary tangles are intracellular accumulations of a modified form of the tau protein. Neuronal loss eventually results in brain shrinkage. So far, scientific research and clinical trials have been based on the so-called amyloid hypothesis, trying to revert Alzheimer's disease by means of dissolving the amyloid plaques. Unfortunately, results were rather discouraging because they failed to produce improvements in the symptoms of patients. Today, researchers worldwide are moving on to examine an alternative therapeutic strategy based on a new hypothesis called the oligomer hypothesis, which argues that the A-beta 142 peptide oligomers, monomers, and protofibrils, instead of aggregated plaques, are responsible of killing neurons, causing neurodegeneration. In addition to A-beta 142 peptide oligomers, monomers, and protofibrils, also other players have been shown to trigger detrimental effects in AD. They are inflammation, oxidative stress, and nitric oxide. The scientific community is realizing that new therapeutic perspectives should consider all of these aspects of the disease in order to significantly ameliorate patients' condition and improving their quality of life.
Following on these thoughts about how to tackle the complexity of AD, lately we ask ourselves, what about using cells that are able to secrete substances with immune regulatory activities and anti-inflammatory actions? But which cells? Mesenchymal stem cells represent one of the most powerful cell types employed for therapeutic purposes. Initially, they were investigated for their effect in cardiovascular disease, renal injury, and graft versus host disease. Later, the enthusiasm was aimed at a possible use in neurodegenerative disorders, including Alzheimer's disease. But stem cell therapy comes with several warnings, including the risk of immune rejections or tumor formation when cells start to proliferate. Recently, it has been discovered that all cells communicate by means of small membrane-delimited vesicles, the so-called extracellular vesicles, which are released into the body fluids. Extracellular vesicles released by mesenchymal stem cells encapsulate proteins, nucleic acids, and lipids, which play important roles in intercellular communication, both locally and systemically. The interest toward extracellular vesicles from mesenchymal stem cells arose considerably over the last years because they bear the same characteristics of the cell they originate from, such as the ability to regulate immune activity, angiogenesis, tumor invasiveness, and wound healing. Indeed, extracellular vesicles-based therapies are considered very promising, and they are being developed and clinically tested for the treatment of inflammatory diseases, autoimmune disorders, and cancer. Given all these characteristics, extracellular vesicles secreted by mesenchymal stem cells are worth being explored as a new therapeutic perspective for the treatment of Alzheimer's disease. But why using extracellular vesicles? Extracellular vesicles represent an applicable, safe, and cost-effective approach in cell-free regenerative medicine and could become a suitable alternative to mesenchymal stem cell-based therapies in Alzheimer's disease. Incredible scientific progresses have been made so far. Information about the mechanisms of action and side effects of extracellular vesicles are being continuously gathered. The best route of administration and personalized dosage will be then a final goal to guarantee extracellular vesicle effectiveness and safety. In fact, several studies have already reported promising results showing that extracellular vesicles from mesenchymal stem cells are able to revert cognitive symptoms in animal models of Alzheimer's disease. And it is true that before passing from bed to bedside, a long way is still to be gone, but maybe it will be shorter than we think.